Hello and welcome to my talk on the ketogenic diet and herbal medicine. This is the National Institute of Medical Herbalists 156th annual conference, and we will be looking at not only the ketogenic diet and why you may wish to implement the ketogenic diet alongside your herbal medicine. We'll also be looking at different herbs that can be helpful while transitioning your patients off of the ketogenic diet. And I will also be focusing on a couple of case studies that we will go through at the end. Okay, so the learning outcomes from this talk, hopefully by the end of this talk, you will have a better understanding of what is the ketogenic diet, also a very brief history of the ketogenic diet, the benefits of the ketogenic lifestyle, also some knowledge about why you should know a little bit about the ketogenic diet. We will talk about when and why you might want to recommend the ketogenic lifestyle for your patients, such as leaky gut, candida overgrowth, die-off, inflammatory illness, and various different autoimmune diseases. We will be focusing on where herbal medicine can be beneficial during the transition from the standard American diet into a low carbohydrate or ketogenic diet. And then we will be looking at, hopefully if time permits, we'll be looking at 2 case histories. Okay, so the history of the ketogenic diet, where it comes from, and the health benefits of the ketogenic or low carbohydrate, high fat or healthy fat lifestyle. Now, the ketogenic diet is becoming much more popular with the population at large, and I feel it is important that as herbal medicine practitioners that we know a little bit about the ketogenic diet and the low carbohydrate, healthy fat or high fat revolution. Myself, I found the ketogenic lifestyle probably around 5 years ago, and it was a wonderful colleague, Miss Afifa Hamilton, so thank you for showing me the way. I found it because my father was diagnosed with type 2 diabetes. My father did not want to go on to metformin or the conventional medications, and I was treating him herbally. So I was using all of the herbs that you might imagine, probably at much higher dosages than you would probably give to a normal patient. I was using all of the most common herbs that you may think of, such as cinnamon, galliga, gemnema, and nothing was working. Nothing was bringing his blood sugar down at all. And then I spoke with Afifa, who kindly consulted with my father and recommended that he go onto a ketogenic type lifestyle. Now, my dad faithfully did this, and within 3 days, his blood sugars had come down from about, I think it was about 9 to 11 millimoles to 5. And it really was that quick. So my father has been on the ketogenic diet ever since. I myself only imparted the ketogenic lifestyle approximately 2 years ago. To give you a little bit of history, the origins of the ketogenic diet are actually pre-agricultural. Before the agricultural revolution, which started about 10,000 years ago, humans, as you are aware, I'm sure, were hunter-gatherers. And as hunter-gatherers, we would have eaten a much more naturally ketogenic diet. We would certainly have eaten a lot of animal products, and this can be evidenced all around the world with various cave paintings that we can see. The cave paintings tend to show the important animals which were hunted. So that's really where evolutionary, we are still hunter-gatherers. The agricultural revolution, 10,000 years does seem like a long time, but in agricultural terms, it is less than a second. So if we move forward now to the modern use of the ketogenic diet, it was actually used as a therapeutic model in children that had non-responsive epilepsy. And by non-responsive, we mean that they did not respond well to the standard conventional anti-epileptic drugs, or for whatever reason could not tolerate these drugs or had an allergy to these conventional medicines. Now, these children with non-responsive epilepsy, some of these children were having seizures, repeated seizures daily. So these were very, very poorly children. And it was discovered that by putting the children on a very low carbohydrate, high fat or ketogenic diet, that the seizures stopped. Once the children went back to the standard American diet, which we will refer to throughout this talk as the SAD diet, their seizures would return. Now, because of this, we know quite a lot about the very low carbohydrate, high fat diet and long-term use, because these children have been eating a ketogenic lifestyle for many, many years. So we can see from this evidence that the ketogenic diet is safe long-term. And we also know from various different studies that have been done, and all references will be at the end slides of this talk, we know that the ketogenic diet is incredibly anti-inflammatory, and that will become clear throughout this talk. Most people that you will probably come across do try the ketogenic diet, mainly for weight loss. It's very effective for weight loss. So you may come across, or I'm sure you will come across patients that are on the ketogenic diet purely for weight loss. Now, the reason why the standard American diet is more toxic to the body is the high amounts of processed foods, but particularly high amounts of processed sugars and high amounts of processed carbohydrates in the form of wheat, flour, and such. The healthy fats that are eaten within the ketogenic diet create less amounts of oxidative stress within the body than the standard American diet. Because of this, the ketogenic diet is anti-aging, and it also increases energy levels. The blood sugar benefits, because you're not eating a high carbohydrate sugar diet, your blood sugars do not spike. And this means that less insulin is needed to be released. So this, in the longer term, reduces a syndrome called metabolic syndrome, or sometimes is referred to as insulin resistance. This is very important. Insulin resistance tends to occur in people after 20 or so years of eating a standard American diet. Other benefits of the ketogenic diet are that when you're not eating high amounts of carbohydrates, because you're not then releasing the insulin, which would reduce your blood sugar and push the sugar into the cells of the body, you're not on that carbohydrate roller coaster. So you tend to feel fuller for longer. You don't have those sugar spikes and crashes. Generally, people on this way of eating will feel much healthier. Their mood improves, and also mental clarity also improves. And I can certainly associate that myself. So let's talk now very briefly about where the standard American guidelines come from, and were they actually based in science? Well, the answer to this question is no, they weren't, which is very shocking. It shocked me. I thought that the guidelines, you know, when you think about the Eat Well plate that we are all aware of, which shows that we should be eating approximately a third of our diet should consist of carbohydrates. We need to know, well, where did that come from? Is it based in science? And the short answer to that is no, it isn't. So if we go back in time, we're looking at the late 60s, 70s. There was a very influential American physiologist who was called Ancel Keys. Ancel Keys had a hypothesis which was called the cardiovascular or heart hypothesis, and he believed that dietary fat, in particular saturated fat, caused heart disease. And he embarked on one of the first studies to look into the dietary habits of various countries around the world. And he was looking for associations between diet and disease, but particularly heart disease. Okay. Now, it is widely known, and there will be slides at the end showing the references for this, but it is now known that when you look back at the data, that unfortunately Keys cherry-picked the data. So you can see on the left of your screen, this is the data that Keys published. And he published the data from 7 countries that fitted his hypothesis. So if you can see that we have Japan, which has a very low rate of heart disease. So you can see that on the graph, and you can see at the bottom, you can see that the percentage of calories from fat were very, very low. Again, if you look at Italy, you can see that in Italy, the percentage of calories from fat is higher than Japan, and also that the death rates from cardiovascular disease, or particularly heart disease, was higher. And if you look at the top of the graph, you will see that the United States, which has the most calories coming from dietary fat, actually has the most amount of heart disease. So if you look at this, it looks very, very good. The curve is an amazing curve. It looks like his hypothesis was right. But if you look at the graph on the left, you can see that Keys actually did analyze data from over 22 countries. And he actually cherry-picked the data, leaving out countries that didn't correlate to his nice graph. So he left out countries such as France. So France eats a huge amount of fat in their diet. They eat a lot of cheese, for example. They eat a lot of red meat. They also use a lot of cream in their cooking. But actually, the heart disease rates of people dying from heart disease in France is very, very low. Another country that was left out was Germany. Germany, they're famous for their sausage, eat a high amount of fat, but again, actually have quite low heart disease rates. So this is basically where the data came from. And now we know that actually Keyes really did select the data, or he cherry-picked the data to fit his hypothesis. And as you all know, that is not how good science it should be done. However, the heart hypothesis really took traction, and now you've got to really look at the time of this. Now, heart disease rates were going up phenomenally in the early 60s to mid 70s, and other factors that could account for this were smoking rates. But the data was run with, and this really is where we get the standard American diets. Don't want to go into more than that about it. All you need to really know for this basic talk is that's where the guidelines come from. They were not, and still are not, based in scientific rigor. Okay, now I wanted to just mention very, very briefly keto flu. Now, keto flu, in my opinion, and it is my opinion, I believe is sugar withdrawal, possibly die-off of pathogenic bacteria in the gut biome, but it does occur, and you do need to be aware of it. So ketogenic flu type symptoms last for approximately, it really depends on the base where the patient starts their diet. So if you're transitioning somebody from a standard American diet, or the SAD diet, that's eating carbohydrates and lots of processed sugar, lots of fizzy drinks, their transition into the ketogenic diet is going to be worse than somebody who has a relatively healthy lower carbohydrate diet, because sugar, particularly refined sugars, but also carbohydrates, are incredibly addictive. So symptoms that people will encounter would be mild to moderate flu-like symptoms. This would include headache, muscular aches, nausea, lightheadedness, cravings for carbohydrate-rich foods and sugary foods, keto breath, and constipation or diarrhea. So I know this sounds awful, and you would think, well, why would I do this? And why would I recommend this to a patient? But the health benefits do really outweigh this short detrimental symptoms. Personally, myself, I really didn't experience much in the way of keto flu symptoms. I did have the cravings, the real preoccupation of just wanting anything sweet. And I can certainly attest to the fact that, without doubt, sugar is incredibly addictive. For myself personally, these symptoms only lasted very short period of time, probably about 4 to 5 days. And once I was through that, I felt incredibly good. So here are some tips on how to avoid the side effects of the ketogenic flu with herbs and various micronutrients. So the main ones that I would like to talk about are increasing the amount of fluid. So keeping your fluid levels up is really, really important. we can deal very effectively using herbal medicines with the sugar cravings, and we can deal very effectively with the die-off. So you all know Gymnema sylvestris does change the taste buds, and it is very effective, I have found, in giving this to people who are transitioning from a standard American diet to a ketogenic diet. And what I generally would do is I kind of prime my patients that we will be going into a ketogenic diet, and I will give them around about a month's medicine and a lot of information on the ketogenic diet. And in that medicine, I will generally give various different doses of Gymnema. And what this does is it generally does help with that tradition away from sugary food, because actually Gymnema is very effective in changing the taste buds so that sugary foods don't taste so nice. So that can be very, very helpful. Die-off is something that definitely occurs, and I've seen this repeatedly with many patients where they can actually feel quite ill. They will get digestive issues such as bloating, wind, incredibly bad headaches. And I would use, all the common suspects there. Depending on the patient, you may want to think of things like cinnamon, olive leaf, golden seal hydrastis, calendula, neem, cat's claw. These are herbs that I would use quite regularly to help with die-off symptoms. Other things that you would want to be aware of are the digestive issues. So when you're changing a patient's diet quite significantly, you will often experience digestive issues, and these can range from real severe constipation to diarrhea. So it really depends on the patient, but I think putting some aromatic bitter herbs into the mix for your patient is a really good idea. And I particularly like the warming aromatic bitters, love a bit of angelica, archangelica. We'll often use Artemisia albs in certain situations, and of course chamomile, wonderful herb. All round digestive. You may also wish to consider adding in some bulking agents such as psyllium husk or psyllium seed. And of course, if you are adding bulking agents to your patient's mix, you need to make sure that your patient is aware that they need to drink more water. Often with a bulking agent, I will use a prebiotic. So generally I will use either slippery elm or marshmallow root powder. I tend to use these two interchangeably. I find that they do have very similar components. They both contain mucilage. They both contain long chain polysaccharides. And actually, I find from an ecological point of view, actually it's better to use Althea, so marshmallow root powder, than slippery elm for ecological reasons. You can also recommend the use of probiotic capsules. Recommend that your patients increase full fat live yogurt. Also, fermented vegetables that are non-pasteurized should be a good addition to the diet. And also products like kefir or kombucha. Some patients will experience fatigue, and some people talk about lightheadedness or muscle aches. Now, this can be due to electrolyte imbalance. So when you embark on a ketogenic diet, generally when you stop eating carbohydrates, the body releases a lot of water. So the weight loss that people experience during the first week or two of a ketogenic diet is water weight. Now with that water will go salt. So sodium, potassium and magnesium are the major electrolytes. So you do want to encourage your patients to add salt to their diet. And you may also want to encourage your patients to take extra magnesium as well, especially if they start to experience muscular cramps. So I tend to give magnesium to everybody anyway, but it's certainly one of those micronutrients that I think is of benefit to have in your dispensary. If you don't want to recommend those types of supplements, then embarking on bone broth can also be a very, very good way of ensuring that you're getting enough of these micronutrients. So bone broth is fantastic, contains a lot of minerals, and also contains particular amino acids called L-glutamine, which helps to heal the gut. So those are very important points. Now, I just want to focus specifically on Gymnema. Now, we know that Gymnema has anti-diabetic, anti-sweetener and anti-inflammatory activities. Lots of studies have been done on Gymnema or gymnemic acids, and the reference for that is below. And we know as herbalists that the anti-sweetener aspect of the Gymnema can be incredibly helpful. They are also very helpful if you are putting somebody onto the ketogenic diet primarily for weight loss. Then I feel that Gymnema is a really, really good herb to use. It doesn't, in my experience, work alone at reducing the blood sugar in a type 2 or pre-diabetic patient. You do need to reduce the carbohydrate level. So although it's a fantastic herb, you do need the dietary intervention as well. But studies have shown that the gymnemic acid in Gymnema do actually stop the absorption of sugar molecules through the intestine. And that's quite interesting because conventional drugs at the moment are also being created that do exactly the same thing. So a very important herb. If you don't use Gymnema, I would highly recommend it. I think it is a really good adjunct along with ketogenic diets. For those of you that like the chemistry a bit, here are some nice images of the gymnemic acid. And this was a reference that I found that was showing that the use of Gymnema as a tea and also as a chewing gum was found to help prevent obesity and diabetes. So that was a particularly interesting article. And as I say, personally, I didn't find that Gymnema worked on its own. You do need the dietary low carbohydrate intervention as well. So looking now at marshmallow root, the reason for marshmallow root is that it contains large amounts of mucilage, which are basically long-chain polysaccharides. Polysaccharides are multiple sugar molecules that as humans we cannot digest. However, our gut microbiota can. So you can increase the diversity of your gut microbiota by using marshmallow root. I tend to use the powder I would always recommend that the patient use cold water when making up their marshmallow root. A lot of people don't like the taste of it or the thickness of it, and I found that if you recommend putting it in a green type smoothie, it's much better tolerated that way. So marshmallow contains a huge amount of different both soluble and non-soluble fibre, particularly those, I'm not even going to try and pronounce those, you can read them at your leisure, but I definitely do use a combination of prebiotics in the form of marshmallow root and or slippery elm, and I would generally combine that with a bulking agent, usually a psyllium husk or psyllium seed, and that really can protect the patient from either chronic constipation or diarrhea, which can happen when you change the diet of the patient. So the reason why polysaccharides in sorry, it's just the noise there, I'm actually in the shop. So polysaccharides, really important. They can be found in many different plants and herb species. They help to balance the microbiota. So we know that the microbiome is incredibly important, not only for digestive health, but also for immune health, for also the mental health of our patients. So anything that you can do to improve your gut biome is really important. And I think using herbs such as marshmallow root, do really help to encourage the natural balance of the microbiota. Okay, so when may you want to recommend the ketogenic lifestyle for a patient? So personally, I have found that the ketogenic lifestyle be invaluable for pre-diabetic or type 2 diabetic patients. Now, it can reverse type 2 diabetes. Now, this can seem quite shocking because most practitioners will believe that type 2 diabetes is a chronic irreversible disease. Now, I can tell you that that is untrue. And we have a huge amount of evidence now to show. If you look at Virta Health, for example, in America is one example, and there are references at the end, but we can bring down the HbA1c, which is basically the inflammatory markers of the red blood cells. We can bring them down to pre-diabetic or non-diabetic levels within 3 months of this diet. So without doubt, pre-diabetic, type 2 diabetic patients, incredible results. Also, I found that women with PCOS, which some people do refer to as a type of hormonal diabetes, especially with women with PCOS who want to conceive. I have actually found this to be very effective. Other cases that I would use, I would actually use the ketogenic diet with any inflammatory illness, particularly osteoarthritis or even rheumatoid arthritis. And I have had real success with maintaining breathing, which is always of benefit, with a patient with COPD. So let's look at our first case study. Now, this was a lady who came to see me last year. She was 72 at the time. Now, she was experiencing severe joint pain. She had also had osteoporosis. she was in a lot of pain, and one of the diagnoses that her GP or the specialist at the hospital had was polymyalgia. So she was in a lot of pain. She also had recently broken her wrist, and that's when it was diagnosed that all of her joints had osteoporosis. Now, what was quite interesting with this patient was that she was diagnosed later in life as being a celiac, as she wasn't actually diagnosed as being a celiac until she was in her 50s. So I discussed with her leaky gut and the fact that because she was a celiac, her ability to absorb the nutrients from her diet was the reason why she was most likely osteoporotic. And I really recommended that we put her on a ketogenic diet. Now, I also gave this patient, because of the amount of pain that she was in, I actually gave her some CBD, which was a paste. So this paste was a 14% CBD paste, and I recommended that she take 1 grain of rice a day. I also put her on the slippery elm and psyllium husk protocol. And I also promoted the use of bone broth. So she was to make bone broth daily. Now, she loved this because she remembered, you know, her mother and her grandmother, of course, had made bone broth. It was something that she was highly aware of. So she really embraced that. So when she came to see me in a month's time, she had found that the pain levels had improved significantly. She felt that the heavy legs that she was feeling was still there. However, she was sleeping throughout the night, which hadn't been happening before. She had stuck to the exclusion diet. She had done so well. She'd cut out all refined sugar. She'd cut out all gluten-free bread, cakes, biscuits. She'd done the lot, and she was having the bone broth every day. She was also taking a fish oil, and I prescribed some magnesium for her. Now, she was experiencing some issues with her shoulder and her hip girdle, and I recommended that she actually go back to her GP because I was a little bit concerned that she did have polymyalgia, and that further investigations just to count that out. So again, I actually wrote a letter to her GP. Never heard anything back. Interestingly, the patient, I asked her to phone her GP. The GP didn't mention the letter, which was quite unusual. Anyway, after this month, the pain levels had improved so much that she felt that she didn't need to go to see the specialist, and she had stopped taking her CBD paste as well because she felt that she didn't need it. So, I mean, that was one amazing lady. She was incredibly desperate, so that's why she stuck to the diet. She was very, very good, and still to this day I don't see her at all now. She doesn't take any herbal medicine. She just relies on the ketogenic diet, and she's been a wonderful advocate for me, actually. She has recommended many people come to see me following her experience with herbal medicine. So she was a lovely, lovely patient. The second case study that I would like to talk to you about is a male patient. He came to me at the beginning of this year. So he first came in February of 2020, and he had a diagnosis of stage 3 COPD. Now, when he first came in, he found it very, very difficult to breathe. We would have to stop and take the consultation very, very slowly. Just want to put this on a nice picture for you. Let's have a nice herb. So initially I did not recommend any change in diet, and my prescription was, he basically had come out of hospital. Oh, his age, he is 51 years of age. He is an ex-heroin addict, which is why he developed COPD. He used to smoke heroin very heavily, and ended up in hospital. He's on a program now, so he doesn't take street heroin at all. He was in hospital. He had a aspergillus infection, so a fungal infection, and pneumonia. He was very, very ill, and when he came out, he decided that he was going to take his health into his own hands. So when he first came to see me, I gave him a prescription tincture and a tea. So the prescription had andrographis, hydrastis, olive leaf, thyme, licorice, lobelia, and dandelion root in the tincture. His tea contained coltsfoot, mullein, and elderflower. Now, when he came back in a month's time, he told me he had an incredibly itchy anus. And that really sort of piqued my diagnosis that there was a huge fungal infection. There was a massive fungal issue. He also had very red cheeks that would flare. They looked very, very sore, very, very red. And of course, the puritis ani. He had a fungal aspergillus infection in his lungs and were given antifungals to take internally for some months to get rid of these. So that's when I really started to promote the ketogenic lifestyle to him. Now, it turned out that this patient remembers as a child eating sugar sandwiches. He was such a sugar addict. He would actually have 4 sugars in his tea. So this was a real difficult one. So when I started to suggest the ketogenic diet, we knew that it was going to be quite difficult to transition. So I was giving him very similar prescriptions. His breathing really had improved. I added some Artemisia abs to his mix. And then after about 3 months, we decided that he was going to go completely ketogenic, and he did. He went from eating and drinking huge amounts of sugar every day to having tuna in olive oil, bacon and eggs, pork belly, chicken thighs, and steak. He reported a huge amount of die-off, and it was horrendous. He actually said to me that coming off sugar was worse than coming off heroin. And we worked together to clear this dye off. So I was using more cat's claw, and I was cycling in cat's claw 1 month and then cycling it with olive leaf. And I would also swap in neem occasionally as well. I started him drinking kombucha. So I make kombucha, so I know that I make one with a very low amount of sugar. So we were using that, which is a prebiotic fermented drink, to help balance his gut biome. he was carrying on with his tea. And after, so it took January, February, March, April, so it took till about the end of April, and then his skin appeared much less visibly red. It was less puffy. His itchy bottom had not improved, but he felt less brain fog. He had more energy, and he really felt that he could breathe better. Now, he's been a patient all year, all of this year. He actually also started pulmonary rehab alongside the herbs. It was all done on Zoom. That made a huge improvement. So I think with the COPD, it really was multifactorial. But after about 3 to 4 months of wholehearted ketogenic diet, and we did implement cinnamon and gymnema in his diet. So the beginning of this month, so the beginning of September 2020, he found that his itchy bottom had gone. His energy levels were so much improved. He'd actually, his sleep, he was sleeping for 7 hours in blocks, which was unheard of, you know. He was bringing up from his lungs quite thick plugs of grey to white hard phlegm. But he said to me that he felt that he could breathe deeper, and that the lower level of his lungs were improved. He had not had a single infection during this time, which in itself is fantastic. Visibly, his accessory breathing muscles were much lessened. He could talk to me for longer periods without being out of breath. And I feel that he was a really, really good patient. And it just goes to show that if somebody is ill enough, they will follow what you say. And he really is an advocate, again, of the ketogenic diet. I think he's quite like I am, quite evangelical about it now, and he's trying to change his whole family into eating the ketogenic lifestyle. So incredibly powerful. So I just wanted to recap basically with the ketogenic diet is not just for weight loss. It can be used with any inflammatory illness, and particularly pain or any inflammatory illness. It is wonderful for weight loss. If you do want to know more about the ins and outs of the ketogenic diet, you can find a lot of information online on YouTube. I would highly recommend Professor Timothy Noakes. I actually trained as a nutrition network practitioner with the Noakes Foundation in ketogenic nutrition. And I did that all online. I know I'm not supposed to advertise, but if anyone was interested in doing that training, I can highly recommend it. You can also contact me, get my number through the NIM. I will happily advise any of you that are interested in learning more about the ketogenic diet. And I hope that you enjoyed this talk, and thank you for listening to the end. Please do contact me if you have any further questions, and I will be more than happy to help. Thank you very much. Bye-bye.